Welcome to the Inspired Hygiene Podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Hello, everyone, and welcome back to the Inspired Hygiene Podcast. I'm super excited about our guest today, Dr. Brad Hughes. Dr. Brad, thank you so much for being with us.
Yeah, it's a pleasure to be here. Looking forward to this.
Me too. All right, you are the CEO and founder of Vision Dental Partners. You are a dentist. And your organization has practices in 3 states, Indiana, South Carolina, Florida. And I've been following you on social media and really enjoying your videos. And so I came across one that talked about accountability equals love. And, you know, this whole season of the podcast is all about rebuilding this hygiene dentist relationship, the hygiene dentist partnership within clinical practice, because we know that that really creates a win for patients when dentists and hygienists are on the same page, creates a win for the hygienist, the dentist, the team, and also for the practice. So I think that topic about accountability is so relevant to this dynamic between hygienists and dentists. And so I'd love you to share, how does that play out in your organization? What do you see are the downstream effects of really that strong leadership from the dental team and having that positive accountability with the team? Love to hear about that.
Yeah. Well, I'll give you the shortest answer. I'll try to keep this under 2 hours because that's a loaded question. And I like it because it's everything. And I think, but you hit the main point, which is it's what's best for the one interaction that matters the most in a dental practice, which is patient provider. And at the end of the day, I mean, we can all go create 14,000 systems and try to create a better mousetrap and all these other things. But at the end of the day, there's only one thing that matters, and that's that patient interaction. And I think sometimes we kind of forget that. And, it really is that, I'll say simple, but at the end of the day, I think the only way that interaction and the only way that the patient is going to be influenced to get to yes at a very high level. And if we're diagnosing, whether it's a hygienist or whether it's a dentist, we should care that patient gets to yes. And the only way that's going to happen is if there's accountability around that. And I surround myself with people that I want to come at me hard. And I mean that with pure love. I don't mean that as if I just need to be yelled at all day, but sometimes I do. If I'm not doing what I need to do, let's go. And you can do that in a very, caring, loving way. And it's a little different when I say yell at me. It comes a little different from different people. But it's the accountability factor that we all need to perform at our best, whether that's as a spouse, as a parent, as a teammate, as a clinician. It's how we get better. And knowing that we have people that care about us that much, that they only want the absolute best out of us is very important.
Yeah. So what I'm hearing you say is that accountability equals love. It's bi-directional. This is not just you holding your team accountable. And that means, hey, I care about you. So I'm making sure you're following our protocols. You're willing to take that feedback as well.
All day.
Yeah.
All day.
And that keeps everybody on on the same page. And I think that is aligned with, I have to just say the clear is kind, Brene Brown leadership strategy is having those clear expectations. So let's run through a couple scenarios. Yep. All right. One common scenario is that maybe the team has agreed that part of the restorative co-diagnosis or part of the handoff from hygienist to doctor is that there's going to be a photo for every time we're recommending treatment. There's going to be a photo, and that when doctor walks in, that photo is on the patient facing monitor. And if you have a different system in your practice, I'd love to hear that. But that, so often what happens is if it's not happening, the dentist will sit down and it becomes kind of a passive aggressive situation where they either pick up the camera and take the photo themselves or they're just frustrated. So how do you handle that in this like positive caring accountability system? Like, how would you handle that?
Yeah, I think that's pretty easy because that's happened hundreds of times,
Yeah.
right? Like I
Yep.
maybe thousands of times. And I
Yep.
think, the simple way to approach that is, I mean, passive aggressive never works. Like kind candor is always going to be the way to win, right? And it's right back at me. Like if for some reason the amount of times I have either like I mean, nobody makes more mistakes in my company than I do. I mean, let's be honest. And so, I get text messages about it daily. I get emails about it daily. I get told to my face, like, yo, Hughes, like you told me you're going to have this done 2 days ago. I don't have it. Where the hell are you at? I need this done by 9 a.m. You're
Yep.
48 hours late. And I'm like, thank you. And so like in that scenario, I think every time, and if the patient is Bill, it's like, look, Bill, you've got this monster crack line down this first molar on the lower left. That's, like the second tooth in from the back. This thing, this crack line is as dark as my scrubs right now. Like, you got to see this. I'm going to have Stacy take a picture for you because Stacy takes unbelievable pictures and she's taking like, she'll take 300 photos today for this exact reason. I'm going to have her take a picture. We need to crown this tooth before that tooth completely splits in half. Like, we love the oral surgeons, but if we can like not have to send you there to go through the implant process, like let's not do it. And I'm going to get you back in soon. Maybe just chill out with that tooth over the next few days until I get you back in. But I'm going to tell the front office right now that I need to see you back soon.
Mhm.
And there you go. And so now Stacy's like, boom, take the photo and off we go.
Is there any feedback then? So assuming that the agreement was that the photo was already on the screen when you come in, then what's the accountability feedback for Stacy after that encounter?
I think the point was made.
Okay. Okay. Fair enough. All right.
I mean, if it becomes a habitual thing, like if you take it one step further and it becomes a habitual thing, like
Yeah.
I might walk in after the third straight patient, just be like, look, all good, but I'll get out of here way faster
Yes.
if like I don't want to be in here any longer than I have to be. Like I already talked to Bill about like college football, and we had talked about the national championship IU Miami game. We had just talked about the Super Bowl. I'm like, I will get in and out fast. And they're like, yeah, yep, my bad. And I'm like, all good. You got this. Like, no big deal. Like, we just an X-ray, an intraoral photo, whatever. If it's up and ready, I can walk in, I can hit that for 30 seconds, do the thing, be relational, and I'm in and out in 3 to 4 minutes. And like, we are on time and we are humming all day and we have high case acceptance. So, it's never like, oh my gosh, Stacy, I'm so sorry, Bill. Stacy's just been off her game today. It's
Yeah.
like, but you know what? The reality is that if I've worked with Stacy for a while, that may be exactly what I do. I'm like, Stacy, you don't have a photo of this thing? And that, like there's that banter too. And like that's when the game goes to actually a whole nother level. And that patient's going, oh, Stacy's in trouble. And Stacy's over there going, Dr. Hughes, you son of a gun. And it's like, but it's because that relationship is so good.
Yes.
That's the level that I'm trying to get to with all my hygienists. And when it's that level, nothing ever, even, I mean, half the time I can just look at the tooth and they'd ask, you want me to take a photo? I know what you're looking at. You want me to take a picture of that? And I'm like, you got it. So it gets to the level when you've built that relationship together. They're reading my brain and I'm reading theirs. And now there's just no question. And it just makes life easy for everybody. And it's a huge win for the patient because they love that back and forth banter. She'll give it right back to me. I'm like, oh, that crack line's as black as the fracture, as my scrubs. Like, well, actually, Hughes, your scrubs are gray, not black. So like, you colorblind, so like that's
Yeah.
the thing. Got to get to that
Because
level.
you've built that trust, and we did a episode on trust with Dr. Mike Sonic recently, and you've built that trust. Stacy trusts you that you're communicating with her in a way that, because she knows she can communicate with you in that way right back. It's not a top down communication where you're coming in and basically, correcting her in front of the patient. Because when that trust isn't built and that level of relationship isn't there, then what it does is it shuts the hygienist down.
Yeah.
And then they're like, oh gosh, I can't even bring anything up because he's just going to shut it down. So I love that. That was a little different than what I expected, but I love that. And it just reveals that, again, that like two-way street with regards to accountability. What about when you have agreed upon standards of care and everybody's trucking along, but maybe there's one person, it's not necessarily, I don't want to pick on hygienists, but this is an Inspired Hygiene podcast. So I'm a hygienist, right? I love hygienists. So, but we see this happen a lot is there's one person on the team in our situation, it's typically a hygienist that's not following those clinical standards. And they may just be doing it quietly, or they may be doing it in a very forward way. Like, yeah, I don't believe that. I'm not doing that. So how does that go down? How does that accountability piece kind of come in there?
We're just going to talk about it. What part, we do have, the standard is the standard, and we're just trying to uphold the standards of the AAP, American Dental Association. And I'm not the dentist that ever sits over somebody's shoulder. I'm not the dentist that's like the most rigid. It's like, look, let's just go have 80% case acceptance on this and live with the 20% that aren't going to do it, because that's just human nature and like whatever. But if we can get to 80% of patients doing the work that we know needs done. So if somebody is maybe under that clinical standard, and it happens, let's just talk about it. Mm-hmm. Why do you, it could be anything. Why do you not think that 90% of adults should do fluoride varnish? Mm-hmm. Why do you not want to do an oral cancer screen? I mean, my best buddy died at 39 of oral cancer. I'm adamant about the fact that we need to do better in the dental space around oral cancer screening. So, why do you not want to do an advanced oral cancer screening once a year and a visual oral cancer screening when we see them the other times? Like, what is it that just isn't up to that clinical standard? And maybe the answer is, well, because you charge $40 for it. And that's because when I did it for free and we were doing a Velscope or an oral ID, and now it's oral ID, nobody took it seriously. Mm-hmm. Nobody takes anything seriously when it's free. Yeah. You don't understand the ramifications. You're not listening to the conversation around oral cancer. You're not understanding. And every single patient, and let me look, 95% of them say yes. And every single patient that comes in and says, I have an uncle or a best friend or a grandparent, somebody that had oral cancer, they're like, you could charge me $400 for this once a year. I've seen it. Mm-hmm. I've seen the morbidity. I've had somebody in my family die as well, or a friend of mine. You could charge me any amount and I would do this, because I never want to be in that position. And it's just, so let's just have that conversation. Let's understand the why. I think it's just getting back to, why are we doing, the standard is just do the work that needs done. That's it. Mm-hmm. Nothing more, nothing less. And, so if you're not up to that standard, I think it's just, let's see if we align on the why. Mm-hmm. And as long as we sort of align on the why, usually those folks will elevate up. It doesn't matter what position. You mentioned hygiene, but it could be a dentist. It could be a front office. If we don't align on the why, then it may just not be the right fit. Mm-hmm. If it's, hey, in order to uphold that standard, I need 2 hours for a new patient. Well, that probably isn't going to fit in with our model. So there's only so much I can do with that. Doesn't make anybody a bad person, just means it may not be the great alignment fit. But it always just comes down to sitting down and having that conversation one-on-one. And it's rarely about wanting to do it or not. Usually it's around the why behind not. And, sometimes that's a bias thing. Sometimes it's insecurity around money, because, oh my gosh, like, patients are going to have to pay $1,000 for this. And okay, well, let's really peel the onion of that layer, or peel the layers of the onion back, and let's get down to the real reason as to why the clinical standards aren't being met. And most of the time it's an insecurity thing.
Mm-hmm. A belief system or insecurity. And that's exactly what we find too. And that's why we start with that why, is developing those beliefs first. And then giving teams like, okay, how do we say that then? Right. Okay. But first we have to believe in it. So I love that. Yeah. Just talk about it. Right. Again, instead of the passive aggressive, or I'm worried that I don't want to talk to this hygienist because I don't want to lose them. But if the clinical results are not at the same level as what you expect and what's being achieved by the rest of the team, it's not fair to the patients. And like you said, that's our number one goal, is to make sure patients are getting consistent care and a great, amazing experience. So I'll take a small commercial break here just to share a free thing that we have. And we're recording this in the winter of 2026. April is Oral Cancer Awareness Month. That doesn't mean that's the only time we do oral cancer exams. It just means we can like shout about it a little bit louder. But if anybody wants to go on inspiredhygiene.com, there's a tab that says free resources or resource guides. There's an oral cancer screening guide on there. It's completely free. There's even a QR code to a video if you're not sure how to do a head and neck, screening. And then also there's a protocol on the back on what do we do. So if we see something suspicious, it's really important to have a super clear protocol and follow-up protocol in your practice so that everybody's taken care of and everybody's on the same page. So thanks for letting me share that. Yeah, I was in a practice a couple weeks ago with one of our coaches, and we asked them, we'd been in there before, like where have you seen progress in the hygiene department, or what really great thing has happened? And within like 3 months, this was a 3-month period, one of the hygienists said they did a head and neck exam and found something that turned out to be lymphoma on a patient. It was discovered early. Somebody else, they did blood pressure, and the patient went to their doctor. I was like, you're about to have a stroke. So seriously, these screenings in the dental practice are seriously life-saving. That is not an exaggeration. So, and that's really where those clinical standards come down to, is like, this is serious stuff that we're doing here.
Yeah, it matters. My wife is an emergency room PA, and they're busy.
Oh,
A lot
yeah.
of mental health issues out there. I mean, we do not have a very healthy society. There are a lot of health issues. And so, yeah, we just have to be aware. We have to have, antennas up, radar on, and we need to know what we're doing.
100%. 100%. Okay. So with you having practices, like Vision is 10 plus?
Yeah. 10
locations. 10 plus locations. Okay. In 3 states. I'd love to hear your insight on the where are you seeing, first, let's start with this. What do you do in your organization to build those relationships between hygienists and the dentists that are in your practices? Is there anything that you're doing intentionally with regards to, treatment velocity calibration and handoffs and that kind of thing? I'd love to hear a little bit about that, if you don't mind sharing.
Yeah, no, I think that's a great question. We're trying to give as much. Now, this is going to sound crazy initially, and I'll explain it. We're trying to give as much to the hygienist as possible because, again, going back to that, the one thing that matters in a practice is that provider-doctor interaction. So I need the hygienist to build the best relationships and the most amount of trust with those patients. It cannot just be doctor-led. And I think too often we get into a case where, maybe on the doctor's side, a little ego kicks in. They don't want the team to be seen as big of a deal as they are. All of these like really crappy things. But so, there should be a handoff with every patient. That hygienist, let's say they spent 40 minutes with the patient. Every time a patient walks in, it's, John was here today for pro feed, Dr. Hughes. We took bite wings. We already went through those. John, we talked about the fact that, this, and this needs done. We got him. We did his cleaning today. There was bleeding on the lower left-hand side between 18 and 19, 4 millimeter pocket. with bleeding, no bone loss. We talked about the gingivitis. John, that's the area that I need you to da-da-da-da-da. Like, just give me the 1 minute synopsis, everything that you went through, just like they're going to do if you're in the ICU and you've got 4 nurses around and the lead nurse is going through the whole thing. Just hand the baton to me. But I want that patient, and I don't want the hygienist standing behind the patient doing this. I want them front and center. I need to be front and center. That doctor needs to be front and center. We need to all be making eye contact with each other here. And I need that communication. I want that patient to see this hygienist smart, talented, into this, knows what they're doing, communicating with the team. And then now it's my job to take over. And then from there, I think you could ask any hygienist I've ever worked with and the hundreds of thousands of patients I've ever seen. I've never one time disagreed with anything they've ever said. And never will. So that's a big deal. So going up to that point, we've communicated before I come in the room. Before any of our doctors come in the room, we're going to go through x-rays. We're going to look at intraoral photos. We're going to talk about what they did that day, what they saw. I want to know what they saw. I want to know what they think. I want to, just be on the same page around what they saw from a decay standpoint, a cracked tooth standpoint, a perio standpoint, all the stuff. And then let's go communicate that to the patient as a team. And I want them to do as much as possible because I think that's how that patient gets to the point where they know them, they like them, and they trust them. And so I think brand building, that's how you build brand, get people to know you, like you, trust you. I think more hygienists, we got to get more and more hygienists into that mindset as opposed to, I'm just checking boxes during that appointment. I got all these things to do. I get it. I mean, there's nuance with every patient, but know you, like you, trust you. I want that patient to say, can't wait to see you again in 3 months. Can't wait to see you again in 6 months. I'm coming back to see, Stacy, not just I'm coming back to get my teeth cleaned, or I'm coming back for a perio maintenance, or I'm coming back. It's like coming back to see that human individual. And that's all we're trying to build.
Yeah, I love that. You hit on so many different points and so many different again, downstream impact that has. So number one, it reduces cancellations because they know if they're coming to see Stacy, Stacy's counting on seeing them. Okay. So right there. And when there's any type of confirmation communication anywhere possible, Stacy's name should be there, right? Whether it's on the phone, in an email, a text, or whatever it is. And that is a simple thing that very few practices do, is call their provider by name. The other thing is, when there are associates, there's, we'll just say, like, I've had this experience. I think this is a common experience in groups and DSOs, is that the associates are there and they want to focus on their work, and hygiene is kind of an afterthought. And what we teach them is, hey, if you and this hygienist can get locked in on your treatment philosophy, they're going to help build your book for you. They're going to help patients say yes and help keep you busier. And, the other attitude of, well, why would I support scaling root planning when it takes the patient's insurance benefits? Like, they're building the foundation. I know, but it's a top-down thing, right? The clinical leader has to communicate the value of all of the care that these patients can receive and how it builds a foundation. And if that's the attitude, the hygienist won't trust that associate. So there has to be mutual trust there all along. So I think those are just really, really impactful, and they're not hard. They're not hard to do. It's essentially, like you said, know, like, trust, respect each other, and communicate.
And when you do those things, that respect just automatically happens. That respect gets built, and it's no different than when you build that relationship with your front office, or you build that relationship with your dental assistant. One of my assistants, Becca, she and I can go back and forth in front of a patient like a, 92-year-old married couple, and people like it. That's the thing, and that's just the way it goes. It's the banter, and people like that because they know that there's a lot of trust there. And I just believe that, there's been a lot of hygienists that have made me look very good, but that's because we've put in the work together. And a great quarterback is only going to be as good as their offensive line, and the offensive line may not get a lot of credit, man, are they important. And our practices are built on hygiene. There's no doubt.
Okay, so with that being said, what are you doing in your organization? What are you seeing with regards to the hygiene staffing landscape across all your locations in multiple states? And I mean, I'm not going to ask you to share your secret sauce, but are there things that you have found that are successful for hiring and retention?
Yeah, I mean, it's hard. Anybody that says any different is like
Yeah.
lying through
Yeah.
their teeth. I'm very transparent. We have some unbelievable hygienists that work in our company. Have we run into some that have done some of the things and the stories that you hear and all this stuff? Yes, like we've certainly hired some hygienists that never made it into the office because somebody else offered them $5 more down the street and a sign-on bonus and all this stuff, and so they kind of just punked us. But you know, it's the nature of the beast right now. But I think for us and my mindset really is just brand. Who are we? And that's attracting those that understand we're not just trying to be a commodity. We're not just trying to have you come in and just, clean teeth and do that stuff. Like I want our hygienists to be as much of a local legend in our communities as the doctors are. I want the relationships to be built among providers and amongst team. There is no hierarchy in a practice. The doctor needs to be the leader, but it doesn't mean that there's a hierarchy when it comes to how these practices operate and run. And, so I think what we're able to do is, and it's no secret because it's hard to do because you have to put a lot of work in, but you have to show people and you have to get attention on you and build brand within your organization. And then you have to back it up. So everything that I'm saying, it better be that way when they come in and start working. Otherwise, that relationship is not going to work out. And so I have to be very on point. And I think that is really all we're trying to do. I mean, you can offer more money, you can offer sign-on bonus, you can do all of these things. But at the end of the day, if you have somebody who's aligned, like we're going to pay very competitively, we're going to do all of those things because that's having a business. But we're looking, just like with the doctors, we're looking for aligned human beings that will put in the work and build relationships. And I want those folks that are looking to build careers and not just have clock in, clock out jobs. And so we really try to attract that, as opposed to, is it harder in today's world than it was 19 years ago when I started? Mm-hmm. In every position, front office, assistants, doctors, hygienists, in every position. So that's how I approach every job title in our practices.
So the brand is very attractive, and like you said, the continuity has to be there. So when they expect something, they show up, and that's exactly what's happening in that practice. And so what you're describing is culture, is having that culture of, focusing on that patient experience, communication, trust, relationship, respect, all those things, high clinical standards. And so there is a feeling out there, or I'll say a mindset out there that, there's not a hygiene shortage. There's a problem with practice cultures. And what I'm hearing you say is that you all have a strong culture and it's still challenging. So, and that is what we see too. We see practices that have a fantastic culture and their team that's there love working there, and they're still having a hard time. So I think it's just fair. We have to look at that from a real standpoint. Now, I'm assuming, and we've talked about this on the podcast as well, is that you all are communicating your brand to your communities through social media and word of mouth from patients and other team members and that kind of thing. And that's super important now.
We're very social first. Yeah.
Yeah. Yeah.
And that really is like, yes, referrals are great. Yes, you should be asking referrals. I think I posted on LinkedIn about that today, actually. Like you should very aggressively be doing that if you really believe in who you are and what you're doing and you love the practice you're working in. Like patients want to hear that. And I don't think we get enough of that in healthcare. Like I want to go places that people are like, you need to send us your freaking neighbors, Hughes. And I'm like,
yeah. Okay.
Yeah, because it just tends to be the opposite so often. Like anymore, I go get a dermatology check once a year and somebody's checking me out and they're like, I got an hour and a half till I'm out of here. And it's like, what? What?
Yeah.
No, that's not what I want to hear. So, just brand is an everyday thing. Culture is an everyday thing. Yesterday is dead. Tomorrow hasn't happened. The only thing we can do is, what do we allow today? And that is, when you talk patient experience, it's really just, I think of everything like the snow melting on the Colorado Rockies coming down in the spring. And it's like that stream that's just beautiful water. It's like the patient's this water coming into the office, and we just have to not create friction and just let them flow through the reception room, flow to the back, flow back up front, and flow out that door with as little friction as possible. And when we can do that one patient at a time, every single day, every single week, every single month, every single year, that's how we win. And it's the process of allowing that to happen that creates good culture, great patient experience, all of those things. And it doesn't mean everybody needs to love everybody every day. I mean, we talked about accountability earlier. Like, there are sometimes hard conversations that have to happen, and that's okay. But it's those moments and those days that build that trust. And, those are the people that I think win together. And those are the practices that become elite over time.
Absolutely. Awesome. All right. So let's learn a little bit more about Dr. Brad. So everybody needs to follow you on LinkedIn and Instagram. And then you're speaking as well. So tell us a little bit about that and what you're doing in the industry.
Yeah. Look, I'm a third generation dentist. I'm just kind of at a point where I'm kind of fed up with the commoditization. I'm fed up with the free exam and x-rays.
Yep.
I do not think dentistry is in a better spot than it was 19 years ago when I started. I just think that the powers that be and the major voices at play, it's more beneficial to them if we just continue down this commoditized route. And I think when you talk to dental students and you talk to young hygienists and this is not the path for them. So many get 5-6 years into this industry and it's like,
They're already burnt out.
This is not as great as I thought it was going to be. It's like, look, it is really hard. You're never going to get away from that. If you want to do it at a high level, it's hard, but there is a better way. And I think that's through brand, becoming a local legend, and brand. And so that's all I want to talk about. How do you do it? How do you build practices based on brand and not just $59 hygiene specials and not just being a network with 25 different insurances, and it doesn't all have to be race to the bottom pricing. And there's a better model, and it doesn't have to be the way that we're headed right now, which is the medical route when everybody in healthcare hates their jobs. So we do not need to do that. So that's really my passion. I'm the anti-commoditization guy. So
I love that. Okay. That's good to know. I love that. Yeah. I was talking to one of our team members recently, and she has a history of pneumonia and she's got bronchitis or something. And she's asking for the vaccine. They're like, yeah, your insurance doesn't cover that, so we're not going to do it. She's like, I will pay for this. Like, this is just not right. Like, it's crossed the line. It has crossed the line to way long time ago with ethics.
I will, and real quick story. So I've had 2 family members in the last month have open heart surgery, my dad and my mother-in-law, right? So my mother-in-law just 2 days ago, my dad had open heart surgery on the day of the national championship game when our Hoosiers beat Miami, by the way. Go Hoosiers. So he's at Duke University Hospital, and one of the top surgeons at Duke, I mean, a pretty good spot to be in their cardiovascular department, in their surgery department. My dad had a heart attack about 3.5 years ago, had a stent placed. He now needed open heart surgery, had multiple blockages, all the things. So my dad said, look, I've had all these tests in the last 3.5 years. How do we go from, like, I've had all these chest x-rays, I've had all this fancy equipment, I've had all this stuff. And he had 2 different doctors, and his primary care and his cardiologist both said, the symptoms you're having probably are like aortic stenosis or something. Like, you're 73, you got a little stenosis going on. My dad said, no, I really think there's something else going on. He fails the stress test, blah, blah. My dad said, how do none of these other tests show up or have anything show up? And this cardiothoracic surgeon says, well, they're pretty undiagnostic for the most part, but we have to do them because of insurance.
Mm,
And it's like,
yeah, check in the box. Yeah.
So instead of just sitting around waiting for him to have another heart attack and die. So that's really good.
Yeah.
So
Yeah,
thankfully
we
we
don't
caught
want to
it.
go down. Yeah, we don't want to go down that route. It is the commoditization and the insuranceization of health care that has caused a lot of our problems. And we'll end on this note because I think you and I, just from our conversation, have the same goals, is just really patient experience, patient health. What are we doing to move our patients closer to health? And there are a lot of things that we as dental providers can do to keep them out of the ER, so your wife doesn't see them. And it reminded me of a book by Dr. Brad Bale and Dr. Amy Doneen, right? Beat the Heart Attack Gene, and also Healthy Heart, Healthy Brain. Talks a lot about very non-invasive tests that can predict things, but are not covered by insurance. So a lot of patients don't even know about them. So we'll put a link to that. I'll send you a link to both of those. And we'll put a link to that in the show notes too, because really great resources. Awesome. Thank you so much for being with us. We'll have to do this again sometime.
Anytime. You know where to find me. This has been a lot of fun. I appreciate it.
I appreciate you. Thank you so much. Everybody take care. We'll see you on the next episode. Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com. And as always, stay inspired.